Welcome to another episode of the Federal Newswire's Business of America podcast with your host, Jerry Rogers.
Welcome to another edition of the Business of America. I took a brief hiatus. I was dealing with some health issues, which we'll talk about in upcoming programs about the importance of nutrition and visiting your doctor, but we'll get into that later. Today, we have a returning guest. I'm very excited because there's lots happening in Washington in public health, in the terms of exchanging ideas. We have with us today, returning today, Martin Kulldorff. You are a professor, you are a scientist, you are a researcher, and you are a co-author, of course, of the Great Barrington Declaration, but also more recently, co-founder, co-author, co-editor of the Journal of the Academy of Public Health. And this is very exciting given that just several days from now, Jay Bhattacharya, a friend of ours, is going to be before the Senate for his nomination to lead the National Institutes of Health, NIH. And so we have lots to discuss. Martin, tell us a little bit about yourself, and then we'll get going and talk about the journal, talk about public health, and where we're going in terms of science.
Well, thank you for having me. So I'm an epidemiologist and a biostatistician. I worked on infectious diseases for a few decades. And when schools were closed and the society was locked down, and when vaccines were mandated, I was in shock because it was all both unscientific and unethical, going against the basic principles of public health. So I think we have a problem with a crisis in the public health community and the scientific community, not among the rank and file so much, because most of my colleagues were in agreement with my views of focused protection, but in the leadership. And so we have a problem with the journals and the university leaders and the funding agencies.
I work and live in the DC metro area. I'm the editor of Real Clear Health, Real Clear Policy. I have lots of opportunities to be around very smart people in terms of public health, science, and politics. The Journal of the Academy of Public Health has people talking in these sectors. I've been to several meetings and people have asked, what about this journal? What's the purpose? What will be its place in the exchange of ideas? Again, it just launched, but tell us a little bit about the Journal of the Academy of Public Health.
So it has four basic pillars. One is that it shares with many other journals is open access so that anybody can read it. And that's a movement that has been existed for a couple of, at least 10 years or more. That when taxpayers pay for research, they should be able to read it for free. It shouldn't be behind a paywall. But that's just a small, solves just a small problem. So we also want the reviews, the peer reviews, to be open for anybody to read. So what happens now in a traditional journal is that a submitted article is sent out for peer review, and they may either like it or don't like it, and the paper may be rejected or not. But the readers never get to see this important work that the peer reviewers do, evaluating the research. Whether it's published or not, nobody sees it. So we think that those reviews and scientists put a lot of effort into evaluating this research. That should be open for other scientists to read as well as the public. So what we're doing is we publish the articles at the same time and together with the peer reviews that other scientists write. And if it's a good paper, that's great. Then the reviewers will say, this is a great paper. If it's a problematic paper, then the reviewers will point out that, there are these problems with the paper, so you should be a little bit careful when you interpret it. And I think that's much better than the current system where a good paper could often be delayed because even it might be rejected even if it's a good paper. Happens all the time. And then it has to be resubmitted to a journal or a third journal and so on. But it's even worse for bad papers because they might be rejected several times, and then eventually they are published in a peer-reviewed journal, and everybody thinks this is peer-reviewed science, even though it received many bad reviews from the previous journals. So it's important, I think, to actually have this open scientific discourse and publish the peer reviews. Also, I think that the reviewers, they put a lot of effort in there, and they should be rewarded for that. The scientists who do peer review right now, they do it for free for commercial publishers who have close to 40% profit margins. So, but it's the peer reviewers who put the added value of journals compared to just publishing it in as a preprint. So we think that the reviewers should be rewarded in two ways. One is to get a nominal honoraria. So we pay peer reviewers $500 for review. And secondly, that they get something that they can put on their CV as a publication. And they get sort of the good reputation by writing good reviews. So that's another principle we have. The fourth principle is academic freedom. So if you're a good scientist, if you're an excellent public health scientist, then you should be able to publish what you think is your important research. There shouldn't be a gatekeeping on that. So we have a principle that excellent public health scientists, they can publish their research in this journal and have the academic freedom to do so.
What do you make of some of the criticism, or not even criticism, because it was more alarm in some quarters, Stat News, I think Politico did a short piece on it. There were some very positive words as well from public health experts. But why would some be fearful or want to push back on this? It seems to me more science, more open dialogue, bringing more into the conversation. This is a good thing for research, for science, for 21st century medicine and science. Why do you think some, especially those in what the political talk shows call the establishment, why would they be a little bit concerned, or is there reason to be concerned?
I think they have reason to be concerned. So I think this new publication model is good for science, it's good for rank and file scientists, and it's good for the public. I do think it's a threat to the existing business model of scientific journals, so they should be concerned.
What about the last time we had a conversation, we were still trying to recover trust in the public health community. And now we've seen some changes. We have a new administration. We have new staff and experts coming into government, specifically now at HHS. We have RFK Jr. But as I mentioned earlier in the program, next week in several days, Jay Bhattacharya is up for his nomination before the Senate for leading the NIH. Are things changing for the good? What do you expect from Kennedy's leadership at HHS and also Jay's leadership coming into NIH?
So trust in public health has plummeted during the pandemic, and there's good reasons for that because the public health establishment messed up. With closing schools was not good, lockdowns, vaccine passports, claiming that masks will protect people even though there's at most a minuscule benefit. So there's good reason for people to mistrust public health at the moment. It's sort of the sane thing to have that view now. But we need to try to restore it. And there's one and only one way to do that. And that is to go back to evidence-based science, evidence-based medicine, and then to be open about it and open discussions. And RFK Jr. has said very clearly that one of the three main tasks or goals that he has is to restore evidence-based medicine. And I think the nomination of Dr. Jay Bhattacharya to head NIH is a clear indication of that, because he's very, very much an evidence-based scientist. But not just him, also Dr. Martin Makary has been nominated to be the commissioner of the Food and Drug Administration, FDA. He is also very much an evidence-based scientist. So we need to get that changed, and it's not going to happen overnight. Trust can be lost very quickly, but to regain trust is a long process, and I think it will take several years. But I think with these nominations, we are starting that slow, tedious climb back to trust.
Now, Martin, again, I'm in the Washington, D.C. area. I'm in D.C. often. I am privileged to be invited to roundtables and salon dinners. And many who are veterans in the public health community, patient advocacy groups, policy think tanks, media, those who write about health and science, I hear very often, the sky is falling. We are going to do great damage to science. I read everything. Unfortunately, I'm up early reading everything, and not everything I read is good. But there's a lot of consensus, even from the healthcare community, that NIH will go the wrong direction. FDA will go the wrong direction. And my response in these meetings is usually, why? Point to what? What is your main concern? And there, we don't get a lot of concrete answers. It's all kind of wrapped up in anti-Trumpism, or it's wrapped up in, well, RFK Jr. is a vaccine denier, or my favorite is they're following Project 2025 and they want to destroy science. Those who know better or have trust in Jay, in Marty, how do we respond to the sky is falling from those who have been engaged in health policy and science, and they've kind of controlled things for a very long time? Is there a good argument to in a civil way, push back?
Well, Dr. Bhattacharya and Dr. Makary both have a long career as excellent scientists. So I think nobody can doubt that or deny that. They were also correct about the pandemic. The United States messed up. What Anthony Fauci, Deborah Birx, Rochelle Walensky, Ashish Jha, and others were promoting turned out to be a big mistake and creating a lot of collateral damage on public health, on cancer and cardiovascular disease, mental health, and so on. The only major Western country that followed the principle of public health by doing focused protection of the older people who were at high risk was Sweden. And Sweden ended up with the lowest excess mortality among major Western countries during the pandemic. So that's clearly wasn't, they clearly did something right in Sweden. I think there are still people in the scientific establishment that don't realize how badly they messed up during the pandemic, and how bad what they did, what bad consequences it had. But there's a slow recognition that most people now accept that school closures was a big mistake, for example. That we should have, even Deborah Birx came out, I think, last week, saying that we should have focused our attention to protect the older people because they were at high risk.
And others, Francis Collins has offered some, not apologies, but hey, maybe we didn't get this right. Robert Redfield is also now working with this administration and working with those trying to reset the public trust in public health. And so you're right. There seems to be some turning. Maybe this is it, Martin. Maybe it's the politicos, it's those who have a political stake are the ones who are slow to accept change, slow to want open dialogue, and they're quick to want to censor. They're quick to want to stifle, and they use the term misinformation. So when they disagree with you or disagree with another scientist, they don't argue the merit. They just simply say misinformation. What about the state of the public discourse in science? I'm excited about the journal. Is this one way to, again, open that debate up and open the dialogue up?
Yeah, it's one way, but it's only one journal. And actually, the goal with the journal is primarily to serve as a role model for other journals to follow. That they will also have open peer review, that they will also reward the important work of doing peer review and promote academic freedom. So, and I'm not so worried about these establishment scientists who are now screaming high because they are afraid. I mean, they have lost their power as leaders in medicine and public health because of the mistakes they did during the pandemic. And Jay Bhattacharya and Martin McHenry and others, they're not in place yet. So I'm very convinced that they will slowly improve the way the system is working. And they have several years to do it. When we see what they're doing, rank and file scientists are going to very much appreciate it because there are a lot of frustration among rank and file scientists.
I know I'm acquainted with Dr. McHenry, with Marty, and I'm acquainted with Jay. And my interaction with them is these are serious men of great intellect. They want to serve, whether it be patients or serve the scientific community. I also think they have lots of grace, lots of empathy. And it's going to be very difficult, I think, during the Senate confirmation hearings or even thereafter to do the normal political attacks on them because they aren't like those who've come before. Speak about the importance of, again, changing leadership. The word disruptor has been used. And so I guess, talk about the idea of disrupting, changing how we do things, number one, but also, the big question still is, well, what about vaccines? We're worried about vaccines. What, the FDA and NIH and the rest, and Kennedy at HHS, we're going to, do away with vaccines. We're going to dismantle the vaccine infrastructure in terms of the CDC, ACIP, and the rest. Can you reassure our audience here at the Business of America that these are serious men of science, and vaccine science, when the science is there, it won't be disrupted, not in a way that will hurt patients. What do you think?
Well, I'm a big fan of vaccines, and the smallpox vaccine alone has saved millions of lives. But if we look back the last couple of decades, when those who are called anti-vaxxers, they never managed to put a dent in vaccine confidence. The reason that the confidence in vaccines has plummeted during the last years is because of the COVID-19 vaccines and the misdesigned clinical randomized trials and the lies that CDC and FDA and NIH were saying about these vaccines and the vaccine mandates. We have known about infection-acquired immunity for 2,500 years, since 430 BC.
Yes.
And suddenly CDC is questioning it, as well as prominent public health scientists. That's what's crazy. So I'm not, as somebody who's very pro-vaccine, I'm not at all worried. I think the only way to restore confidence is actually to do many of those studies that people are looking for, including randomized placebo-controlled trials. And if you look honestly at vaccines, they are a great benefit as a whole, but there are also adverse reactions you can have to vaccines, and we have to be very honest about that. And some vaccines are very, very important, critically important, like measles. But there's also very real questions about the vaccine schedule that we should answer. And for example, I'm from Scandinavia, and in Scandinavia, the childhood vaccine schedules have fewer vaccines. And children in Scandinavia are actually very healthy, more healthy, I think, than in the United States. So there are some vaccines on the schedule that might not be so necessary, so that are not that important. So I think we have to roll up our sleeves as scientists and actually do these vaccine studies, both for efficacy, but especially for vaccine safety. And there are a lot of interesting questions. For example, the measles vaccines, the measles, mumps, rubella, MMR vaccine, we give it typically at 12 months together with the DTaP vaccine. But in Denmark, they give the DTaP at 12 months and then the MMR vaccine at 15 months, 3 months later. And that might actually be better the way they do it in Denmark. So we could do a randomized trials to test these two different options and see which ones works out the best.
Martin, you make sense. And I think that's the challenge. Men and women engaged in science and this public discussion, and also in research and writing and such, those who want to have an open debate, those who want to have a conversation. I can't wrap my head around why some are so resistant to having a conversation about the vaccine schedule, about how we move forward in building trust in vaccines, which leads me to this question. Maybe our last question. I'm mindful of your time, and that is the United States in particular, but of course it's not just the U.S. These innovative companies, the biotech community, the pharmaceutical community, they are creating new therapies and new medicines that will enrich our lives, prolong our lives, make our lives better, living and these sorts of things. But just like the public health community, have the innovators, have they also lost the public's trust? And how do they win it back? Those who are doing the research and those who are creating these new therapies and these new medicines, many of them, politicians, but also the public, don't trust them anymore, or they're losing trust or have lost trust. What do you think about that? How the innovators win back the trust?
The innovators both in academia and universities, but also in the pharmaceutical industry. There are many good scientists working there who are developing these new therapies that will benefit us. So we need to encourage that. But I think what the problem is that there's a conflict of interest with the regulatory side on FDA or CDC on recommendations, where academic scientists are also working on grants or being paid by pharmaceutical companies. And I think we need to sort of get rid of that conflict of interest. It's great for scientists to work with pharmaceutical companies, but the people who sit on the FDA advisory panels or CDC advisory panels, they should be free from any such conflict of interest from any pharmaceutical industry. And we shouldn't have this rotation where people are FDA commissioner for a few years and then they go off later and get a high-paying job at Pfizer or Moderna or Merck or some other company, which is very common right now. So I think we should stop that revolving door and the conflict of interest. And that's one thing that RFK Jr. has been pushing, and I think that's very good.
It's very interesting you say this because, I've worked for members of Congress. And again, that same revolving door problem existed. Members of Congress would vote on legislation and then retire from Congress or lose election and be hired by the interest that benefited from that legislation. And so now there are some rules in place that you have to wait a number of years. Some say it's not stringent enough, but I'll leave that for another program. But maybe something similar in the public health community, where if you served at FDA or another entity, you have to wait a number of years. There has to be some kind of cool down period, so to speak, before you can become a board member or chief medical officer and these sorts of things. Is that workable, you think, kind of a period of time where you have to wait?
I think that's a great suggestion.
Okay.
And I hope that RFK will implement that.
You see, my concern is because, Martin, individuals like yourself are few and far in between. And so I want American industry, pharmaceutical, biotech industries, to have access to the finest minds. But I understand, especially from the patient perspective, there's a potential for conflict of interest. But this is something that can be solved. And I guess that's where we can end this. With all our troubles, with all our even the mistrust, there's lots of solutions moving forward. And I'm very excited about 21st century medicine. I think there are new cures, new vaccines, new medicines, new therapies that we haven't even discovered yet or know about yet. And I think it's very exciting. Do you see a hopeful future in science and medicine? Are you a despairing optimist? Are you just despairing? What do you think? What's your state of mind when it comes to science?
It depends on the day, but with science itself, I think is wonderful, and I'm in love with science. And science will always be there, and it will always help us, help humankind to live better and more fruitful lives. With the scientific community, I have so many colleagues who do excellent work that's also good. And with the scientific establishment of the leadership, I think there's going to be a fight now, because the old guard is losing their power, or they're losing their control, and they're going to fight back. So I think there will be some turbulence in the next couple of years, but I think that's good turbulence, and I think we need some reform. So
I think you're right. And just to kind of the trickle down civics of this, my father told me as a kid, if everyone's happy with what you're doing something wrong. And so you're doing something right. I'm excited about Jay and Marty. I'm excited about the direction of public health entities. We should do this again soon, after Jay has been in leadership and after Marty's been at the FDA and the other agencies too, and maybe do a review. How are they doing now? That'd be great fun to have you back. Congratulations on the journal. For our viewers, it's the Journal of the Academy of Public Health. You can just go right there and find it online, or you can go to any of the Real Clear Science, Real Clear Health, and there's a icon there where you can get to it. When is the next publication? Is there a focus? Anything that we should know about the journal before I let you go?
So we publish things as they come in. So there's no like issues or monthly or so. We publish things regularly, and go read the articles, but also read the peer reviews.
Very good.
All those articles.
Very good, Martin. Thank you so much. This has been a great conversation. I've been anxious to have you back, and like I said in the beginning of the program, I've dealt with some health issues of late. But as our audience can see, the color's back in my cheeks, and I'm all right. So here's to good health for both of us, and for our audience. Again, thank you so much for tuning in. Please like this page, follow it, do whatever you have to do to make sure that our audience is growing. This, of course, has been another great episode of the Business of America. Thank you.
This has been the Federal Newswire's Business of America podcast, hosted by Jerry Rogers. Check out the Federal Newswire's family of websites, as well as their social media stream